So we have with us Dr. Susana Almeida, Secretary General for International Generics and Biosimilar Medicines Association. Thank you so much, Mas, for your time. And Sasha, it's great to have you in India. And you spoke about the single global development for biosimilars. What exactly does that mean? How does it actually speed up access to medicines for the global population?
So just a minor correction, it was for biosimilars, but also generic medicines.
Okay.
It's very important that we have this possibility. The possibility of having a single data package for registration in multiple regions is a reality for the originator medicines. And it's not a reality for generic medicines and biosimilars. And the reason for this is because until now, we didn't even have a harmonized standard for the conduction of biosimilars studies. There are guidelines about the development of biosimilars, but the concept is fairly new. And in addition to a leading standard, a harmonized standard for the development, you also need two other things for single data development to be possible.
Sure.
These are the fact that the legislation in a country or region should allow for use of a foreign comparator product. And if you allow the use of foreign comparator products, what foreign comparator products is acceptable? And this must be defined in guidelines. So the concept that I'm talking about is already used in countries around the world. I shared during my presentation some examples that were coming from a publication from the IPRP. And there are a number of countries with very developed regulatory systems who accept the use of foreign comparators. So writing a guideline on this topic should not be that difficult. There are examples out there, and it's a scientifically based process. This is not to say that foreign comparators, the reference products in the various regions are always the same. So this is why we need criteria for in what cases can we accept a foreign comparator product from that jurisdiction. What requirements does the product have to meet? And these are the topics that need to be defined in a guideline. I think until very recently, because we didn't have a harmonized international standard, for example, for bioequivalence, the discussion was very difficult because even if foreign comparator product was acceptable, if you have to run different types of trials for the requirements to be met in regions, this does not really work. But now that we are moving in a direction of international harmonization for these topics, it's really time that all of the regions consider this, because the landscape of products that are reaching beyond that patent life is really shifting towards complex products.
Yeah.
We also have biosimilar products who are very distant to develop, and therefore good careful thought should be given to this, to make this a possibility in a scientific driven.
Right. So another point which came up in your presentation was about clinical trials, which are actually repeated. We also termed it as unethical because data is already generated. So a quick point on that as a comment. And secondly, do you see there is a cost saving? Because you're actually eliminating a lot of overlap and a lot of repeat studies. If there is any study that actually gives you some idea about how much could be the savings in terms of costs, because the repeat studies can be eliminated from the experiences that we all find.
So then the part about the unethical conduct of the trial, if you have a reference product between two regions that meets a certain number of criteria that shows this must be the same reference product, there's really no added value in scientific terms to repeat the study just because you bought a package in this jurisdiction or that jurisdiction. So that's the reason why in cases where these requirements are met, it's really unethical to repeat the studies, because you're not getting any additional valid scientific information. the estimation of costs is difficult. But if you consider, for example, in patients, and this happens because some products are too toxic to be administered to healthy volunteers, if you were recruiting patients, the complexity and the cost of the trials increased dramatically. And not only that, the other aspect is if you are doing 2 studies in the same population, and it's a difficult population to recruit, you're going to have to develop one of the studies before the other one. So one of the packages for one region is going to be ready before the package for the other region. And if the patent situation would allow for registration, then you're actually delaying the access to more affordable, quality assured products in the region that cannot be, the study cannot be conducted first.
Where? Ma'am, from the global perspective, where do you see the Indian company going from here in terms of being competitive? Any key messages that you have for us in the biosimilar and pharmaceutical generic company?
I think it has to be recognized that the role that the Indian pharmaceutical industry plays in providing access to off-patent products in various places much beyond India. We see that there is a huge contribution to the discussions that we have at global level through IPA and the members of IPA. So we really value the contribution that the Indian companies give to our work, and hence IPA, our work of IPA does to support determine what they need out there and why these regions. I also must say that it's a great pleasure for me to be here. Events like this one, highlighting the importance of quality, getting the stakeholders around the table and discussing these efforts are extremely valuable, because with that, they are highlighting the importance of quality. We are understanding each other's points of view, and this is a critical step to make things work. So I really want to acknowledge and recognize the great work done by ITA, and I'm very thankful that they invited me to come here and speak about these topics that are so important.
Wonderful having you, man. Thank you so much.